And we're live. So good afternoon, everybody. I hope you're all well. So today I've got the lovely Vicky Bateman, who is a physiotherapist, and she's kindly agreed to come in and talk to us all about returning to exercise after having a baby. So I know myself that I have a lot of ladies that come along and say that, when do I start back? 6 weeks. If I'm a 6-week check, right, that means I'm fine. That means I can start running, I can start jumping up and down, lifting weights, I'm absolutely fine. And that's not the case, is it, Vicky? So I'll hand it over to you if you can give an introduction to who you are, what you do.
Okie doke. So my name is Vicky Bateman. I'm a musculoskeletal physiotherapist with a specialist interest in pelvic floor rehab, postnatal rehab. So I've been working in MSK Health for 8-9 years-ish now, and then over the last kind of 3-ish years, I've gone more down the women's health side of things. After having a baby, suffering issues myself postnatally with pelvic floor dysfunction and lack of knowledge, lack of support in my recovery. So that's when I went on to do some further training and then became a Mummy MOT practitioner as well. And yeah, the rest is history. So personally, after my first child, I went back to exercise way too soon. So I was, before baby, I did loads of hockey, played at a high level, was quite fit and active, and then had baby, put on loads of weight, everything inside, and then was just like, I need to get back. So not having as much knowledge back then, even though I was a physio, less so in the pelvic health area. I went back way too soon, did way too much, and then started having issues really. But I guess that's a whole nother Facebook Live or Instagram Live. So I see a lot of women in clinic that will come usually for a Mummy MOT, which is 6 weeks onwards after childbirth, and
just explain what a Mummy MOT is, because I think that every woman should be having one straight after.
Yes.
Yeah. So if you understand what it is.
So it's an assessment that you'll seek privately, so it's not something that's funded by the NHS. And basically, it's anywhere between an hour. I tend to do an hour to an hour and a half thorough assessment, whether you've had a vaginal birth or C-section. And what we do is we go into depth on your kind of your birthing history, previous medical history, all that kind of stuff, and then we'll do a physical assessment on your posture, your alignment, your breathing as well, because that's a massive one postnatal in recovery. And then I tend to check out, your hips, your back, how you're moving, your core stability, how you're functioning. We'll have a look at your scar as well, if you've had a C-section, how that's healing. And then if the lady wants to, you can have an internal assessment as well, and that just checks your pelvic floor function, checks the kind of the tone of the walls, if there's any issues there, dysfunction, what your strength's like, if there's any prolapse, that kind of stuff.
Sorry, Vicky, have you got a microphone? Because it sounds like you're using your microphone or something.
I think it's just internally in my computer. Am I a bit tinny?
That's it now. It just seems like, when you put your hand over a mic, that noise.
Okay.
Yeah, you seem now. I think you're okay now. Go on ahead.
Yeah, so I think I've got everything there. So that's kind of it. And then we talk through the findings. We kind of discuss a management plan, treatment plan, a prognosis, and then with some ladies, they can carry on with what they're doing already. With some, it's just a bit of advice and reassurance that they're doing the right things. And with others, they need a little bit more kind of follow up and input into their rehab if their their pelvic floors not functioning as well. So yeah, I tend to see ladies as either a one-off or over several months to get them back to their goals, really.
We also check the tummy muscles as well, because a lot of ladies have issues and they don't realize this until further down the line. But I always think that if that's caught earlier, there's a bigger chance for recovery.
Yeah, it's and again, well, that's called diastasis recti or tummy gap, tummy separation. So that's part of the assessment. So I'll just check in terms of what gap they have, how deep it is, where they are in their postnatal, and then we go through kind of a set of exercises to try and get the most tension out of the middle part of the tummy. And then I'll usually send them home with those exercises to work on and progress them down the line. Tummy gap is really, really common. 100% of women now, we know, will have it at the end of their pregnancy. It's a normal part of pregnancy. Your tummy muscles have to move apart and stretch to make way for baby, make room for baby. So it is very common. And usually if it's persistent and it's affecting your function, your pain, then obviously we can rehab that as well. So yeah, that's a big one, and I think that's where the breathing comes in the early stages as well, because a lot of people think, I can breathe. I breathe.
In mine now, deep breathing, yeah.
And I'm one for not taking in enough deep breaths in the day and very much breathing up here and not having a minute. But it does play a big role especially in the early stages postnatally.
Yeah, well, it's good to remember that to breathe, because we don't actually breathe. We're always holding our breath as well, and we get, clenching our teeth, etc. But what do you say to women who think, I've had my 6-week check, I'm good to go? Because we both know at these 6 weeks checks, they're for the baby. Mummy doesn't really get seen much at all. So
I didn't go my second child, my 6-week check. Yeah, so there's, if the Mummy MOT was on the NHS, it would be amazing, but it's not. So it's something I really, really do encourage. I would say, listen to your body. 6 weeks postnatally, you're still, as strong as you might have been beforehand, you're still early days. After cesarean, for example, it's major abdominal surgery. So, there's types of exercises that you wouldn't want to be doing in the really early stages, even if you were really strong beforehand. So if we're thinking about the recovery stage postnatally, with C-sections, if we're focusing on C-sections, the tensile strength of your tummy muscles, the abdominal wall, is not recovered 100% by your 6-week check. We know it takes a lot longer to recover, but with C-section and with a vaginal birth. So your body's not really ready to be going into anything full exercise, full running, high impact stuff. There's some really, really good guidelines out there, which you're probably aware of yourself, that are actually accessible for everyday Joe blogs as well as fitness and health professionals. That they're written by Grania Donnelly, Emma Brockwell, and you see the guy Tom Goom, I think it is, a running specialist, and they give you a really, really good timeline of the types of exercises you should be doing it in certain stages of your postnatal recovery. So I will always go by them when I see patients in clinic, and refer them to those guidelines when they're thinking about returning to exercise, whether it be running or or low impact stuff. So yeah, if I see them 6 weeks, sometimes it's about educating ladies, sometimes it's about reining them in a little bit and just making them aware of the actual recovery process, and that you're still healing from the inside out. So just listen to your body, give yourself time.
Well, this is it. You've been all that pressure on your pelvic floor. You need to give it time. You need to properly heal your body before you start going out and pacing the footpaths again. And there is gentle exercises you can do, like a bit of yoga. And like you say, just listen to your body and stop putting so much pressure on yourself to think. And we are so bad for this, thinking I have to show everybody I'm straight back at it. No, the only person putting pressure on yourself is yourself.
I know. It's hard. It is hard. I remember with my first, it was I need to get back into shape pre-baby. And to be honest, there's few women that will get back to pre-baby weight and pre-baby shape. You'll always be a slightly different shape because, but I think we need to embrace it a little bit more. I think we're too hard on ourselves, and we just need to give ourselves that time to recover and realize that we've done an amazing thing by growing a baby and birthing it. So
yeah, exactly. And what about if women have had any tears down below?
In terms of recovery or returning to exercise?
What sort of recovery would you recommend? And yes, what would your advice be on that? I've had a few questions about that. I've had an episiotomy. How long should I leave it before I start doing yoga or stretches? I suppose I may be worried about maybe stretching it or causing it more harm.
Well, you can still do your gentle, your pelvic floor stuff in the early days, your low level core exercises in the early days. It's about checking it, I think, regularly in the early stages. There's a lot of women that will never have even looked down there even before baby. So it would be a good, I might be going off tangent a bit here, but it'd be good to have a look before, getting pregnant, during pregnancy, down below, see what's your kind of normal, and then see how you're healing afterwards. The midwife, health visitor will always go through, looking out for signs of infection and things like that. But in terms of early stages, your pelvic floor exercises are the most important, and your scar massage as well. Yes. So just like scar massage with, with your C-section, scar massage with any tears or episiotomy as well is important. It might be worth sharing some links as well to that, because there's a physio she's on Instagram, Claire Bourne. She does a lot of videos on managing C-section scars, managing episiotomy scars as well, and how to massage them as well. Because if we think about scar tissue, and that's scar tissue with any surgery or any cuts, anything, anywhere on your body, when tissue heals, it's all kind of meshy and mishmashed, and it doesn't like to contract and relax as well as normal tissue. So this is where your massage comes in. Really, it's really important after in your postnatal recovery. To give your pelvic floor the chance to be able to contract and relax well.
Okay. So what other advice can you think for women that might be
postnatally? I think what I do with a lot of women is discuss their goals. So some women just want to know, what they can do, low impact, how they're healing, that kind of stuff. Some women want to get back to elite sport, so it's educating them on the recovery stages, and also giving them kind of short-term goals to get back to the high impact stuff. So again, if we refer back to those guidelines we talked about, if we were thinking about running a more high impact exercise, you're looking at the 3 to 6 month period postnatally. And that's really if you've got no signs of pelvic floor dysfunction. So it might be, you're looking out for like heaviness, dragging sensation down below, any type of incontinence, whether it's urinary or fecal incontinence. You're looking at if you have any pain on intercourse, if you have any lower back, pelvic pain before, during, and after running, or any high impact activity. So we're looking at all those things. If you have any of those when you're trying to get back to more higher impact stuff, then it might be that you just have to regress a little bit and work on the fundamentals really before you strengthening them a little bit more and accepting load a little bit more before you're getting back to the running. And then if we're thinking about actually returning to running or anything like, your HIIT classes and things, you have to do it progressively. So it's not right, I'm strong now, I've done some tests in clinic, I can go out and do a 10k run. We tell a lot of ladies to do maybe the couch to 5k, or started with the buggy running, buggy fit, I think it's called, and do it progressively. And that's another one where you have to rein ladies in sometimes a little bit, is yes, you've done a marathon before, but you need to start somewhere, and it's getting those little short-term goals, which does motivate women, because I think rehab is, it's never, up and up and up. There's lots of peaks and troughs, especially with pelvic floor dysfunction. You might have times during the month in, your cycle where, things don't feel as strong as other times in your cycle. And there's loads of other factors that will affect, how strong you're feeling and how your recovery's going. Another point to make is breastfeeding. So a lot of ladies that come into clinic, they might say, do I need to stop breastfeeding? I might feel a bit stronger and be able to return to running quicker if I stop. They might have been told that by X, Y, and Z.
That's a new one in me. I've never heard that one.
Or to do with their supply. So if they're a really keen runner and they're running, long periods, long distances, they're worried that it's going to affect their supply as well, which the evidence now shows that it doesn't, unless it's extreme circumstance, where you're doing extreme exercise and you haven't got the calorie intake,
makes sense.
to replenish that. Otherwise, it doesn't affect. It's more about the timings of your feeds to, empty your breasts and, off you go. So that's another kind of myth I wanted to make a point of. Trying to think what else.
I think one for me would be, if you are starting back to any form of exercise, fitness, any pain whatsoever, do not think you can just push through it. I know women do that. They think, I'll push through it, it'll be fine, it'll get better next time.
Yeah.
You need to be listening to your body. If it's not happy.
That's it. And it is about, we do say listen to your body a lot, but I think especially when you're pregnant and you give birth, you're quite aware of your body and what feels normal and what necessarily doesn't feel normal. So yeah, it's just taking it easy, early days, start with your pelvic floors, your low level core stuff, build it up to doing, your low impact exercise up to brisk walking, your static bike, cross trainer type stuff. And then when the 3 to 6 months is kind of a guideline, but again, with no pelvic floor dysfunction, you can get onto the higher impact stuff. And it might be that when you start back running, even if you just do 5-10 minutes, you can start, if you're out and about, start uphill because it's less pressure, less stress on the pelvic floor, walk down the hills, run up the hills, jog, walk, just progressing it back to increasing your distance slowly.
Yeah, and the other one as well is, and I wish more mums thought about this, try and avoid lifting the baby in the car seat as much as possible. I see women going around the supermarket, it's put over their arm like it's a Chanel handbag, and I can tell with their eyes that this is excruciating. And the damage it's doing to your arm, let alone what it's doing to your pelvic floor, put that child into a pram or into the shopping trolley. Don't be doing that. It breaks my heart every time I see it and they're yanking it around.
It's hard. It's hard.
Minimal, less time as you need. Yeah.
I think that's it. And, there's, It's a difficult one because sometimes especially, if you've got a second child as well, and you do what's easy. So I think, what we say in moderation, I don't know, but not all the time. When you are postnatal, you're always loading your body anyway. You're lunging, you're squatting, you're deadlifting, even though you don't realise you're doing it. You're doing it, picking baby off floor, putting them into the cot. So yeah, it's about being mindful of the way you're lifting. I think getting your breathing right when you're lifting as well. To give that pelvic floor a little bit of an uplift when you're lifting heavier things.
Yeah. No, I still remember one time my youngest was a few months old and I was late going somewhere and he needed a feed. And I remember going up the high street with this youngster attached to me feeding and dragging the 3-year-old behind me.
Yeah, brilliant.
Oh, the things that we do. Oh, Victoria, thank you so much for that. That was really, really interesting. Really interesting. The breastfeeding one's now a new one on me. I've never heard that before.
Yeah, it's a new one, but yeah, no, it's been good. Is there any other questions or anything else?
I haven't seen any more coming in. Let me just check it this way.
Trying to think.
I can't see any coming in afterwards. What I'm going to do is I'm going to. You've got a Facebook page, haven't you?
I've got Facebook, yes, and Instagram. I tend to put more stuff on Instagram.
Yeah. I'll pop your Facebook link into the bottom of this so anybody who wants to can reach out and chat to you themselves if they want to. Are you doing online appointments at the minute?
Yes, it's over on the CTC Healthcare website. You can book on virtual and face-to-face.
Can you stick that link in for me, if you don't mind, in the comment box?
Oh, is that it?
And then we've got that one in there. That would be fabulous. And yeah, thank you very much for that. I will let you get back to your evening. And yeah, I will talk to you soon.
Oh, thank you
very much.
Bye-bye.
Bye-bye.